I've heard many people say it's worthy of a study in social change, because seldom do you get so much change to be so effective and sustained. And so I want to start out. I know most of the focus and the buzz about OCNI has been this terrific new model for articulating two-year programs and baccalaureate programs and to help the progression, and it's certainly done that. But we're going to focus on the absolutely innovative work at the curricular level. We're primarily going to focus on the curriculum level, but you really can't separate curriculum and pedagogy. Right. So I'm going to ask you to give us a little insight on how this all came about, because it really is one of those miracle stories.
It is, and we often just said the planets lined up, because we couldn't really come up with a better explanation on some days. But we were inspired early on by the forecast for a devastating nursing shortage.
Right.
And realizing that we somehow were going to have to step up ourselves and with scarce resources, figure out how to educate more nurses. We also had a mandate from the nursing leadership in the state that to, as they put it, transform nursing education to more closely align with emerging healthcare needs and practices. And so we took this mission very seriously. We first decided that we would form a consortium, that we would build a partnership between community colleges and the state-supported 5-campus university. And that in this partnership, we would figure out how we could get more students more education, essentially, try to encourage them to continue on. We started with a number of agreements that we would have a common curriculum, which was, I'm not sure that we would have decided that had we known what it would take to get there, but once we were there, we celebrated it. So to do that, then we had to have a kind of structure that would work in both the community college system and in the university system. So we agreed pretty early that students would still be able to graduate from the community college program with an associate's degree and sit for the licensure exam, but that they would have a smooth transition to the university and be able to complete the work for the bachelor's degree in another year.
And I remember that being a bit of a compromise, because the pie in the sky would really be to have this articulated, seamless program where the students would go directly into their baccalaureate.
Right, exactly. But we said we're building a baccalaureate curriculum from the get-go. So this really isn't 3+1. This is the baccalaureate curriculum, meaning that we're aiming toward baccalaureate competencies that we'd agreed on, and we're aiming toward introducing some of the concepts that traditionally are held for baccalaureate education, introducing those early, so that there's time for the students to really build toward what we'd see as a baccalaureate level of competence. So there was agreement on all of those. We started with having the agreement about competencies that we got together with our practice partners and agreed on a set of, at the time, about 15 competencies that eventually became the 10 OCNI competencies guiding the curriculum. And those involved ethical practice, clinical judgment, relationship-centered care, communication, interprofessional practice, systems thinking, evidence-based practice. All of those are key parts of the competencies.
And they're broad competencies, it should be noticed, which I think is the only way to go with a professional competency-based curriculum.
Otherwise, you end up as infinite regress with 400 competencies down to the minute level. And those competencies end up then being reflected in each of the courses. So there was broad agreement on the competencies, and that some concepts traditionally held for baccalaureate education would be introduced early. So, for example, to develop the habits of mind needed for independent clinical judgment, that's an early attitude, if you will, and a habit that you want students to begin to develop. You want students to begin to develop a habit around evidence for practice. And developing those habitual ways of thinking, we think needed to start early. So it starts in their very first course. So how we got the curriculum developed, I think that's kind of a fun story.
Yeah, and